We're talking more about AIDS and HIV with Jon Lutz. He is an infectious disease specialist, and Laurie D'Avignon. She is a hospitalist and infectious disease specialist, both with Ben Memorial Clinic. So thank you for joining me today.
Happy to be here.
Dr. Lutz, first to you. We hear AIDS, we hear HIV. What's the difference?
Well, HIV stands for human immunodeficiency virus. It's an RNA virus, and more specifically, it's a so-called retrovirus. One has infection with HIV virus. We say someone has AIDS when they have reached such a state of advanced immunodeficiency, such that they're susceptible to different unusual infections that are characteristic of immune deficiency. We call those opportunistic infections, or sometimes so-called opportunistic malignancies. Also, we say someone has full-blown AIDS if their helper T lymphocyte count is below a certain number, namely 200. Okay.
So it sounds like someone, when they're first diagnosed, would be diagnosed with HIV, and then as the disease progresses.
Well, unfortunately, a percentage of patients present with an advanced state and come to the doctor or the clinic with full-blown AIDS.
Well, and that's like Susan was talking about. People just don't know they have it, correct?
Often, yes.
Often. So what are the signs and symptoms that you might have this?
Well, early in the disease course, one might have absolutely no symptoms, and that contributes to the transmission of the infection. If someone is unaware they're infected. Sure. They may feel perfectly well for several years. But later on in the course of the infection, they may experience such things as thrush, which is a yeast infection of the mouth and throat. They may experience chronic diarrhea. They may get pneumonia, including that due to unusual organisms. They may experience wasting, weight loss. They may experience fevers and night sweats. They may experience skin infections such as shingles.
And the bottom line is, if you think something is wrong, it's important to go see your doctor.
Absolutely.
Anyway, yes. And so we do want to talk about prevention as well. How do you prevent getting HIV and AIDS?
Well, there's a few ways to prevent it. Primarily, we ask people to have open discussions with their sex partners about their status, and to use condoms for unprotected sexual encounters. Certainly, clean needle exchange programs are very important in preventing HIV transmission among people who are using intravenous drugs. The other thing that I think is probably the most important is that people get tested and know their status. We have, I believe Susan mentioned, we have 34 million people living with HIV, and about 50% of those people actually know that they are infected. So we have a huge number of people who don't know their HIV status, and they pose a risk for ongoing infection. We know that once people learn their HIV status, they change their behaviors and they're less likely to spread HIV. They're also able to get on treatment earlier, which gives them better clinical outcomes and also decreases the likelihood that they will spread it because their viral load is much lower, so they're less likely to spread the infection. You mentioned treatment. Once someone is diagnosed, what does the treatment look like? So in the old days of the epidemic, the treatment was very complicated. People were on multiple drug regimens or multiple drugs, and they had to be taking those drugs often on an empty stomach. Now things look much better, and we have several options that are once-a-day pills. We were able to combine 3 drugs into 1 pill. So for many individuals, their first regimen is simply 1 pill a day, which makes it much more likely that people are going to take that treatment as directed. And that's one of the most important factors for someone living with HIV, is to take their medication every day on a regular basis. And once-a-day pills really help that. So you mentioned 34 million people. That's globally. Correct. So are we still seeing high rates of incidence, high rates of prevalence? Well, the prevalence has continued to rise because that's a measure of the number of people who are living with the disease. And now that we have antiretroviral therapy available, people are living longer and longer. So we have more people living with the disease. The incidence, fortunately, has been decreasing steadily in most parts of the world, including the United States, where it has been slightly decreasing or stable over the past 5 to 10 years. But in most countries of the world, countries in Africa, prevalence has been decreasing. There are a few regions that, unfortunately, it's increasing in Central Asia and Eastern Europe, and driven primarily by intravenous drug use. But globally, we're making a lot of progress.
What is the outlook, and Dr. Lutz, I'll direct this to you, what is the outlook these days for persons living with HIV and AIDS?
Well, the prognosis is excellent, provided they're on appropriate antiviral therapy and provided they're compliant. Compliance is very important. If the patient is taking their antivirals incorrectly, missing frequent doses, they may acquire a resistant virus, which complicates therapy, necessitating second or third line therapy, which may be less effective or more complicated to take or more toxic or more expensive. But generally speaking, the prognosis is very good, and the patients can expect something approaching a normal life expectancy. People are indeed living so long, they're living long enough to acquire such things as heart disease and getting coronary artery bypass grafting like everyone else. And there's a lot of other diseases that are common in the aging AIDS population because the epidemic has been around for 30 plus years, of course.
Well, Dr. Lutz, talk about the maternal-child transmission.
Well, in a mother who's untreated, the transmission rate was upwards of 25 to 30%. Some years ago, it was demonstrated that the administration of AZT, the first effective antiviral, cut the transmission rate by approximately 2/3 down to 8%. And there's better regimens still now. It's important for the HIV-infected mother to be on effective antiviral therapy, and also for the newborn infant also to receive effective antiviral therapy. And the transmission rates are substantially reduced as a result of these advances.
Well, and thank you so much for coming today. I really appreciate it. Thank you.
You're welcome. We're happy to be here.
Thank you. We'll be right back.